Today, I'm talking about a topic that affects millions of people, but oftentimes goes unspoken. How do you know when it's time for hearing aids? Maybe you've been wondering about it, or maybe you're here because a loved one is starting to show signs of hearing loss but doesn't want to admit it. Either way, you're in the right place. Stick with me as I break down the 5 signs you're ready for hearing help. And I'll explain why addressing these early can actually protect your brain, your relationships, and your long-term health. Hi. I'm Dr. Layne Garrett, doctor of audiology and founder of Timpanogos Hearing and Tinnitus. The first sign I want to talk about is a pretty common clue. The people closest to you are starting to get frustrated. It's not usually you who notices the hearing problems first. It's your spouse, your kids, your friends, your coworkers. You might feel like you're doing fine, but they're the ones that are repeating themselves, raising their voice, and seeing you withdraw in social situations. Think about it. You spend the most time with these people. They're the first to pick up on the fact that you're starting to miss details or that you've been mentally checking out in conversations because honestly following along takes so much effort. I hear it all the time in my clinic. I don't think I have a hearing problem, but my wife says I do. And honestly, the wife is usually right. The second sign is fascinating. You're starting to notice hearing aid ads or articles online. You're scrolling through your social media or watching TV, and for some reason, those ads are getting your attention. You might even find yourself Googling the best hearing aids or do I need hearing aids? That mental curiosity is not an accident. Your brain knows you're struggling, even if you're not consciously admitting it yet. Bonus tip. Even if you're drawn to over-the-counter hearing devices, I strongly encourage you to see a licensed hearing care professional first, who will test your hearing, explain your options, and help you avoid wasting money on products that aren't going to meet your needs. The third sign is one that hits home for a lot of people. Are you always using speakerphones or turning up the TV volume? Here's why that matters. Speakerphones let you use both ears at the same time on the phone, which doubles the sound clarity. If you're dependent on that feature, it's a sign that one ear or maybe both aren't quite keeping up. And if you've caught yourself turning that TV volume up a little bit louder than you'd like, or maybe asking people to speak a little bit louder, or maybe you're starting to speak a little bit more loudly yourself, that's your brain's way of compensating for what it's missing. Even more subtle, you may try to dominate conversations, because if you're doing all the talking, you don't have to strain to listen and respond. It's a clever coping strategy, but it can hurt your relationships over time. Fourth, you're someone who values prevention and staying sharp. Many patients come to us before they're in hearing crisis because they understand something really important. Untreated hearing loss is linked to cognitive decline, including dementia. Studies from Johns Hopkins and other institutions have shown that when your brain is deprived of sound stimulation, it actually has to work harder to fill in those gaps. And over time, that extra strain takes a toll on your memory, focus, and mental sharpness. If you're the type of person who's proactive about your health, if you already exercise, eat well, and stay on top of your checkups, then adding a baseline hearing test should absolutely be part of your hearing health plan. Before I go on, you could do me a huge favor. Give this video a thumbs up and don't forget to subscribe to our channel. This helps people find us and learn more about evidence-based ways to treat hearing loss and their tinnitus. Now, the fifth one is something that many people overlook. You're experiencing tinnitus, that persistent buzzing or humming in the ears. That's like the check engine light for your hearing. Tinnitus isn't just an annoyance. For many people, it's one of the earliest signs of hearing loss. Here's why. When your ears stop picking up certain sounds, your brain starts to try to fill in those missing sounds, and that's what creates a sensation of ringing. If you've been hearing phantom sounds, don't ignore it. Get a hearing evaluation. That can reveal whether there's an underlying hearing loss, and in many cases, hearing aids can actually reduce the tinnitus by restoring the sound that your brain has been missing. And finally, not necessarily one of the signs that you're ready for hearing aids, but let's talk about birthdays. Did you know by the time you're 55, most people are already experiencing some level of hearing loss, whether they're noticing it yet or not? By the time you're 80, 80% of people need hearing aids. That's why I recommend anyone over the age of 55 who hasn't had a hearing test to go get one, even if they think they're doing fine. We call those baseline tests, and it helps us to track your hearing over time and catch any issues early on when they're easiest to manage. Think of it like an annual eye exam or a dental checkup. Hearing health matters just as much because it's deeply tied to your overall quality of life and brain health. Now, here's something I want to emphasize. Treating hearing loss early leads to better outcomes. When people wait too long, their brain starts to forget how to process certain sounds. And when that happens, even the best hearing aids can't completely reverse those years of neglect. By acting early, you give yourself the best chance to maintain sharp speech understanding, social confidence, and preventing cognitive decline. And remember, hearing aids today are not the bulky devices from the past. They're sleek, smart, and packed with technology that adapts to your environments automatically. At Timpanogos Hearing and Tinnitus, we're here to guide you every step of the way. If anything in this video resonated with you, please don't wait. Call us for a comprehensive hearing evaluation if you're here in the state of Utah, or you can visit our website, thebesthearing.com. You can also get a free copy of my book, Hear Us Out, that talks a lot about hearing loss, treatment options, and what you should be looking for when it comes time to treat your hearing loss. If you are seeing any of these signs, don't forget that you deserve to hear clearly, connect fully with your friends and family, and enjoy every moment with the people you love. Please don't wait. Get the help you need.